charge. Here's the voices. Here's the men and women who talk about the work that we do.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we just got a message from Marilyn in Long Island. I guess she's in the Hamptons and likes to listen to the ocean, but there's one thing that she likes to listen to better than the ocean, and that's Dr. Lederman in the Radiosurgery Hour. So I appreciate that, but at 10 o'clock you can get back to the ocean until next weekend. There's a new article, and we promised to give you news articles, and this was from Wall Street Journal in a study that looked at robotic surgery for bladder cancer. Again, the robotic surgery approach is supposed to have lights and cameras and see everything so the surgeon doesn't have complications. I guess it's digital treatment in a digital age. The problem is the robot can't feel. So when a surgeon opens you up, which you don't want to have anyway, the surgeon's hands are inside your body and the surgeon can feel things. The robot may have lights. Well, the surgeon has eyes, but the robot can't feel anything. Well, there's a new study that looked at bladder cancer with treatment randomly allocated between the robot, which was a Da Vinci robot, versus open surgery, and it found that the robot was no better than open surgery to reduce complications. And according to this report by Joseph Walker in the Wall Street Journal, this surprised researchers who had thought the robotic technology would be superior to human hands. Well, another disappointment. Many disappointments, in fact, from increased complications to no improvement to complications with prostate cancer being higher. Now, this study for bladder cancer cast further doubt on the benefit of this robot, the Da Vinci, which allows surgeons to perform minimally invasive surgery from a computer console rather than directly on the patient's body themselves. There was another study that looked at the cost benefit for Da Vinci for hysterectomies, and it found that it wasn't really beneficial from a cost point of view as well. The robot obviously is a couple $1 million, and the parts for it cost an arm and a leg. So in New England Journal of Medicine, there was a letter this past week written by surgeons which randomly allocated 118 patients with invasive bladder cancer to have their bladders removed with Da Vinci or open surgery. Open surgery requires a larger incision in the abdomen. And then there was reconstruction of the bladder, which is done with open surgery. But the robotic surgery patients had similar complications to those having open surgery and similar length of stay. So it didn't shorten the length of stay, it didn't shorten or diminish the complications. The cost is higher, so you have to ask, what's all the brouhaha about? I would say if you have bladder cancer, you might want to give us a call at 212-CHOICES, because we can treat bladder cancer non-invasively, and for most patients have a high success rate. Data has been accumulated over several decades looking at results of focused radiation versus surgery. You get similar results, avoiding removal of the bladder, maintaining a higher level of quality of life. So I think that's what most people want with bladder cancer. Obviously, most people don't want bladder cancer, and you may want to stop smoking if you're a smoker, because smoking leads to increased rates of bladder cancer. If you have bladder cancer, you might want to learn about all the options first. And just because robotic wasn't better doesn't mean surgery is better. You may want to consider non-invasive treatment if you have bladder cancer. To give us a call, sit down, and learn the actual data that's accumulated over many, many years. And that's true for localized bladder cancer or even metastatic bladder cancer, which we treat with fractionated stereotactic radiosurgery. And speaking of smoking-related diseases, now we know that smoking is going down in America, thank God. This week we saw a 47-year-old man with metastatic adenocarcinoma of the lung. Now listen to this. In April, he started coughing up blood. Coughing up blood is an ominous sign, often associated with lung cancer. He went to a big hospital in Manhattan. They opened him up, removed the lung cancer surgically. They didn't stage him. Now, we've talked about on this program repeatedly staging. Actually, a recent study showed that people with lung cancer, if they're fully staged, a third of them will avoid that big surgery on their lung. So why wouldn't the surgeon stage him to avoid the surgery on the lung? What do you think? Well, this man had surgery in April. 3 weeks later, he had seizures. He was found to have brain metastases, which I would suspect were there 3 weeks earlier. Brain metastases don't grow that fast. So what do they do for the brain metastasis? Do they talk about options? No. They opened up his head and removed brain metastasis. This is cancer from the lung that spread through the bloodstream to the brain. And then, a month later, they opened up his head again. So April, May, June, 3 big operations all within about 6 weeks. Can you believe it? And then he went to another hospital with worsening neurologic symptoms, and they opened up his head too. No one talked to him about radiation. No one talked to him about brain radiosurgery. No. Finally, he saw a doctor who I know well. He sent him to me for treatment. We staged him up. For the first time, he's been staged up. We know it's in his head, multiple brain tumors. Even though he had 3 operations on his head, he still has 3 or 4 brain tumors. One is even growing at the site where they removed it, which is not uncommon, because surgery often leaves cancer cells behind. So surgery often does not negate the need for radiation. But in this case, he was never sent for more treatment, so the cancer grew back right where it was and elsewhere in more spots. And in his body, we found a big mass in the adrenal gland of cancer, adenocarcinoma. So we are now finally taking the bull by the horns, and he's been very debilitated. Even though he's only 47, he's been very debilitated by these 4 operations in just a short period of time. He has a big scar on his head from ear to ear going over the top of his head. He has a scar in his lung. He had, I believe, metastatic stage 4 cancer when he was diagnosed. There were options then. Radiosurgery is very effective at bleeding, at stopping bleeding, so most likely that hemoptysis, which is the medical name for coughing up blood, could have been stopped with radiosurgery. We often do that. Same with the brain metastasis, and same now with the adrenal metastasis. So it's a lesson that, yes, surgery sometimes has a role, but it's not the only role, and you may want to investigate all the options before you have your body entered. This man, I believe, wished that he had. We can't go back in time, but we can try to stop the cancer he has today, and that's the work we're doing. He's seen a multidisciplinary team, and we wish him well. And even in this week that I've seen him, he's already perked up quite a bit. So it's great news for him to be on a path with a better chance of control. And this week, one patient recommended us to another patient. Actually, his daughter's husband's grandfather from Florida came in, a man with colon cancer. He's 83 years old. His daughter pushed him for a colonoscopy, and you all should have colonoscopy. It hasn't been done on a regular basis. She pushed him in 2013 to finally have colonoscopy. The doctor tried to do colonoscopy, and he couldn't get the scope beyond a mass in the rectum. So the man had little or no symptoms, but at colonoscopy he had a large rectal cancer, and the cancer already traveled to the liver, meaning stage 4. So he was biopsied. He was sent for chemo. He's lost about 10 pounds. He's living in Florida, and he came to us because the chemo stopped working in parts of his liver. Parts it works, parts it doesn't work. Why does that happen? Why does chemo work for some tumors, not other tumors? Well, there's tumor heterogeneity, just like if you have 2 or 3 kids, they all have the same parents, same house, same food, same school, same air, but they're not all the same. And the same is true for cancer. Sometimes cancer has clones or groups of cells that evolve in a different way. So this man has liver metastasis from a rectal cancer, and some cells are responding to chemo, and others are not. So he obviously wants to get the cancer that's not responding to be controlled. And that's what we're doing. 5 treatments with radiosurgery. Each treatment's 15 minutes. He walks in, gets his treatment, walks out, feeling fine. He has a couple more treatments, and he's heading back for Florida. And we wish him a safe trip and a successful treatment. And we follow our patients. How do we follow them? Well, we usually get a repeat CAT scan or PET scan, cancer markers like for rectal cancer, CEA, like prostate cancer, PSA, like breast cancer, CA15-3, like pancreas cancer, CA19-9. So there's a lot of markers that are useful so you know if the treatment is working or not, if the cancer is going into remission or not. It's something that you can look at and you can understand. And while the test is not perfect, it's highly reliable. We're going to stop for just a moment. This is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center. We take care of new cancers. Sometimes we diagnose cancers. We see a lot of people with lumps and bumps and masses in the breast and the neck and the face. People who have been reluctant to get seen or diagnosed come in, and usually within one day we can make the diagnosis easily, usually non-invasively or minimally non-invasively. So you know what's going on, and you can then learn options, choices that are available, and determine how to best get treated. So please don't be afraid. Please give us a call at 212-CHOICES. Medical questions, 212-CHOICES, which is 212-246-4237. Again, this is Dr. Lederman. We're going to stop for just a moment to hear from our sponsor, and then we'll be right back.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day.